Hi, I'm Kim. I'll just be explaining to the class today about how to use a nebulizer or how to instruct a patient about how to use one and why they might need one. So we're going to start off today with how we normally do any procedure, so it's washing your hands. So we'd also put on gloves just because since we're using a mask, we'll be, well it's just in case, so we'll be working around the mouth, so in case you might get any sputum or any spit on you. So after this is all finished, each patient should have their own nebulizer, either next to them or maybe this is the first time you're going to educate them about how to use it. So sometimes we might have a disposable equipment, but for today we're going to educate Miss Betty Hatcher about how she might use her nebulizer. So this is her first time. So first you introduce yourself, so you say for example, "Hi, I'm Kim, I'm your nurse for today. I'll be explaining to you about how to use your nebulizer." Oh, by the way, Betty is 12 years old, so we might have to use, we might have to educate her with language that is appropriate for her age group. Kim, I'll be teaching you about how to use something called a nebulizer. And so we've got lots of different parts. We've got the mask, the tube that connects it, and the most important bit, the little cup of medication that you need to actually breathe into. So your teacher, obviously a nurse might not always be there, so you're going to have to teach her how to use one when a nurse isn't available. So we talk about how first you get your medication. So always make sure that with any drugs, make sure that the expiry date is there, so it's expired in 2012, so that's fine, or if you're not sure, double check with a nurse. So this is Ventolin, and if she's 12, you just say that drug that'll help you when you breathe it in. It's a preventative, or it's something that will help you in the morning, so you can take it in the morning and at night time. So you take it before in the morning so that when you do something during the day you won't have any breathing problems. So this will help your asthma, so you don't have to worry about getting into trouble when you're doing vigorous activities. Okay, so you teach her about how to do it herself. So you take the cap off, and before you do anything, make sure that all of your equipment is clean as well. But since it's the first time, they should be. So we take the Ventolin, and we'd have to twist the cap off, and then squeeze all of that into the medication cup. Okay, and then we dispose of this. And we'd also add some saline, so we'd also put some water to mix it around with it. Make sure that you put this in, otherwise it won't mist when you do start the machine up. So we need to mix the drug with some water, and we'll put that away. Then reseal the cap or the lid. Make sure it's very tight. And then we get the mask and make sure that the mask is appropriately sized. So if the patient, for example, is under 2, they should be using, over 2, they should be using a mouthpiece. But for now we'll use a mask, just because mouthpieces would give more adequate medication for the patient. But right now we have a mask. So we twist that one on, just so the nozzle hits where the nose bit is, the nose piece. Then we'd get the end of the tube and connect it to the nozzle at the back, which should be around the mouth area. So you have to squeeze that on very tight. Check the tube for any holes. And we connect the other end into the nebulizer. Make sure you do that. Keep it upright so you prevent any spillage. And then you place it over the patient's face. Make sure that the patient is also sitting upright and in a comfortable position, and place the mask over the nose and under the chin. Make sure it's very secure as well, so always check before you put the mask on, you should turn on the machine. Make sure that it is misting, and when you put it on top of her face, make sure that there's no mist that's leaking into her eyes, as that's very discomforting, and moisture on the face could cause irritability on the skin, so you could be getting rashes on the skin. So right now we've got that started, and you'd educate the patient about how to breathe. So we want the patient to be breathing slowly and clearly but through the mouth, because it's much better for the medication to go into the airways rather than the nose, because there's so much space to come up here, but you want it really to go through the mouth, so it's direct into the bronchi and it'll be distributed properly into the airways. So what we want you to do is we want you to breathe very slowly, and for this might take about 10 to 20 minutes to finish. What you might hear is sputtering, like what you hear when it's raining. So once you hear that noise, you could tell one of us nurses that it's about to finish, and we'll come and take it away from you. So you don't have to worry about that. So we'll leave it on for 10 to 20 minutes according to how long it will take for each patient. It's a bit different. So we'll pretend that it's finished now, and turn it up, and then just connect it there. Make sure you tell the patient to wash her face, as it's she's got a lot of moisture on her face, and that might give her any reaction or skin irritability. And also tell her to rinse her mouth out, so that will prevent all of thrush. So thank you for that. I'll take that off. Okay. So then, obviously, after any use of the nebulizer, it is the patient's equipment and they might be reusing it. So the most important thing is afterwards you have to clean the equipment. So obviously this would be empty, but with the cup and the mask, what we do is we put it into warm soapy water, so it cleans all of the equipment, and you tell the patient that mind your mum and dad to do this, or mum and dad might be there already. So just tell the patient or the patient's parents to clean the equipment and put it in soapy water. And this is because you don't want to prevent any bacterial. For a while and make sure it's properly dry before you store it, and it'll have to be in a dust-free environment. Dust and moisture-free environment. And then with the tubing, what we do is we get an alcohol wipe and then wipe the ends, and then store it in the patient's bag. And that would be also with the mask and the medication cup when it's dry, when it's properly dry. So that way it'll stop cross-contamination. If anyone might happen to mistake it as theirs and maybe use it, put it in a bag. And normally it's good to just label it with the patient's details, like the medication or the MRN number, and also make sure it's maybe stored in their drawers. Also with the medication before, make sure you check, before giving the medication to the patient, make sure that you do check the chart, the medication chart, and also check with the wristband. Okay. And thank the patient for their time, and just double check to see if they're okay with everything that you've explained to them. Thank you.